Well, in the run-up to the school year, we were being warned about the return of respiratory viruses in schools, but with the fall season flu and RSV rates falling off, we're facing the resurgence of another virus, the Noravirus, a highly contagious digestive bug, which was somewhat muted during COVID-19. So, for a look at prevention and treatment, we're joined this afternoon by Dr. Dina Kulik, pediatrician and founder of Kid Crew. Dr. Kulik, thanks for joining us here. So, when it comes to this Noravirus, highly contagious, digestive bug, how do you know if you have it? Do you need a diagnosis, or is it pretty obvious based on symptoms?
Well, lots of stomach bugs kind of exist in the world, and so depending on the season and the day or the month, different bugs kind of go around. Right now, the most prevalent of the stomach flu bugs is Noravirus, but they all give the same kind of symptoms. So vomiting, diarrhea, belly pain, cramps, decreased appetite, sometimes fever. And right now we're seeing a lot of it, but there are many different bugs that do those same symptoms.
Right. So what seems to be triggering the rise of the Noravirus once again here? Is it a lack of masking? What's happening?
It's hard to say. This is the season for stomach bugs and many different flus and viruses for sure. It's winter, we're indoors, and kids mostly are not masking anymore and may not be being as diligent with hand hygiene, and that would be typically from our hands with some contamination. And they are very, very hardy bugs that are easy to pass on between people. Even sometimes hand sanitizer is not enough. Washing our hands works much better. Not sharing things with our friends, not putting toys or other things in our mouths that other kids have touched. These are strategies that are helpful, but very challenging to do when you have young children around.
Yeah, there is no doubt about that. That is incredibly challenging for sure. As a father of 3, I can attest to that. I know you have 4 kids yourself. So let's talk about treatments here. If you have this, you go to the doctor, you go to somebody like yourself. What is the sort of what do they need to do in order to have this treated and take care of it? Or is it just like, do you need a couple of days to get through it, or do you need a proper treatment?
Yeah, typically these go away by themselves. They're viruses, so antibiotics don't make a difference. We want to make sure, first and foremost, that kids are hydrated, so that they're drinking even just small amounts, but more frequently can be helpful. If kids don't have great appetite, I'm not fazed by that. You can go a few days without eating, but I do want to make sure that they're drinking small amounts. Sometimes we'll use over-the-counter or prescription medicines to settle vomiting down. That can help if a child's vomiting a lot and losing fluids and is uncomfortable, of course, by vomiting. Diarrhea goes away by itself, though. We don't typically give medicine for that because we want the virus to go away. We want it to exit the body, and it comes out with the diarrhea. So it's that and rest, fluids, and again, very good hand hygiene so that the rest of the members in the family don't get it as well.
And that's fascinating that you mentioned the idea about that hand sanitizer may not be enough and that thorough hand washing is key. Do you think people are still getting that message, or are people, as far as your practice is concerned, what are you seeing? Are people kind of forgetting about that importance of such a basic, fundamental way of staying healthy?
Yeah, I think we've, in a lot of cases, swung back in the other direction after COVID. I think people were very tired of hand washing and distancing and masking and keeping kids home. And so a lot of kids are going back to school when they're probably better off staying at home for another day or two to get better. And in so doing, when we send our kids back or we go back to the workplace, we could be spreading viruses. And that's why all these viruses perpetuate and become so prevalent.
Okay, always good to have the conversation with you, Dr. Kulik. Thanks for joining us again here on CP24 Live at noon.